You can catch full coverage on 5 Live from 5 p.m. and watch the match with Guy's commentary right here on BBC One.
You can take the shirt down from the wall now, can't you? Lots of us will be tuning in to watch the football tonight, but for some, it will be a struggle if you're watching it, because vision is something that millions of us have problems with. Cataracts is one of the conditions that GP Dr. Helen Wall lives with. We're going to find out more about what it's like for you in just a second. But can you just start by telling us what it is exactly?
Yeah, so cataracts are basically a clouding of the lens in the eye, which is a small transparent disc, or at least it should be transparent. What happens with cataracts is over time it can become cloudy or misty. And, you know, when we're young, our lenses are like looking through a clear window. But when you start to get cataracts, that can become very misty, more like a bathroom window. And, you know, we've got an example here of what it can look like with cataract vision.
Beautiful in
beautiful in both, obviously. But I think the image on the cataract vision is perhaps quite far down the cataract line. You know, initially it can be a little bit just sort of lose that crispness of your vision. But it can be difficult for people because it can affect things like driving and doing their normal day-to-day activities, you know, as it progresses. So it is something to be aware of.
Yeah, if your vision's like the one on the right-hand side there, you probably wouldn't want to drive like that at all, would you?
Well, there are clear driving regulations that you need to meet on the DVLA website. So people with cataracts can drive, but they need to be clear about how severe their cataracts are and how much it affects them. I was told that I've got cataracts because of I'm very short-sighted, and that's my prescription is -11.
Oh my God!
Which is quite significant.
But what has your experience been like with cataracts? How did you first get a glimpse of it?
So I've had poor vision most of my life. I can remember being in primary school and struggling to see very clearly, and through time it's gone worse and worse. So as I said, you're short-sighted, and my vision is now -11, corrected with glasses or contact lenses. But recently, sort of 18 months ago, I started to feel like things were misting up. So I was on holiday, I was taking my sunglasses off and kept wiping them, thinking things are just not as clear as they should be. There's sun cream on these. Actually, it was my vision deteriorating. And when I got to the optician for my regular review, I was quite shocked to be told that I had early cataracts, which, you know, somebody who I consider myself very young, I was shocked at that, even as a GP, because it's not something you think about. You kind of think about it in old people, and obviously that's not me. But there are you know, significant risk factors.
If you get it in the first place. I'm like -8.5. I think my sister's 9.7 or something.
Yeah, so you definitely need to listen to this next bit.
Go on then. Yeah. Well, yeah, absolutely.
You could recognise some of these.
What are the causes of it then?
We don't really know what the causes are. There are risk factors, which we'll talk about. So we can go to the risk factors here. We can say family history. So sometimes your mum or dad may have had cataracts, smoking, uncontrolled diabetes, if you've had a previous eye injury, or you've had long-term steroid use, particularly steroid drops into the eye, too much alcohol. These are all things that have been cited as risk factors. But generally speaking, we see them in older age. So over a third of people over 65 will have cataracts. So it is considered more of an older age problem, although we do see it in babies and children as well. And the 8-week check that we do on babies when they're 8 weeks at the GP practice is a key part of checking the eyes for that. So it can affect anyone ultimately. But yeah, there's certain risk factors that make you that little bit more prone.
Now, you said, Helen, that you found out you kind of had something going on because you couldn't see through your gut. But what other symptoms are there that people should look out for?
Yeah, there's a few symptoms. So that sort of blurry, misty eyesight, the thing that things just aren't as crisp as they should be. Sometimes people suffer with a bit of light sensitivity, so the lights can seem blurry. You might have a halo or glaring around lights, particularly at night when the street lights are on. You might find it particularly hard to read or see any detail in low light. So having bright lights, you might suddenly realise you're having to have the lights on more at night when you're reading in bed, or a brighter light to see things. And colours may look faded, as we saw in that previous image, as you progress more into the cataract becoming more severe.
Can you treat it? Can you treat cataract?
Yeah, so there's more. The main treatment, or the only treatment really, is surgery. Now, not everybody will go for surgery because there's a huge spectrum of how severe cataracts can be. So I'm at the fairly mild end at the minute. I have discussed surgery with my ophthalmologist, but I'm not there yet. Now, somebody who does lots of fine detail work might have to go for surgery earlier on. It's very individualised, decision, and some people might never go for surgery because they might just manage. If you're not driving, if you're not working, you might find that you don't want to go down that road. But there's no medications, no drops that can reverse this. It's all about sort of seeing how long you can manage for. Sometimes you can have adapted aids, magnifying glasses, brighter lights. But at some point, if you want to get your vision back to where it was, you will need surgery.
And what is this surgery like? Is it easy, quick?
Yeah, so surgery, I believe, is very quick. It's a day case. It's a day case procedure. It's 30 to 45 minutes. The problem is that it can take up to 4 to 6 weeks to recover from it, and your vision can be blurry and not quite where it needs to be for that.
So is that
point.
what you're thinking about it? Because like 4 to 6 weeks
so
as a mum and doing
so
the
I've
job
been told, it's really up to you when you feel you want to go down that route. But obviously, I'm a full-time job.
Yeah.
I work. I've got 3 children. I'm constantly ferrying them about to different activities. I don't want to have 4 or 6 weeks where I can't drive and can't work. So I'm sort of at that point where I'm managing now. I can do everything. But I know at some point there's going to come a point where I have to make that leap.
Do you do both eyes at the same time?
They tend to do one first. You can do both, but that's rare. They tend to do one because with any procedure we do in medicine, there's always a slight risk of things not going quite to plan. It's better if that happens on one eye rather than both at the same time. So they let one eye recover and then 6 to 12 weeks later perhaps go for the other eye. And some people may only have a cataract on one eye. It does vary from person to person.
Oh, wow.
Thank you for telling us about your story, and also it's really good to hear about it. I'm sure we'll get loads of questions on this and about our eyes this morning. We're going to give you the chance to ask the Morning Live